At the May 2015 World Health Assembly, country leaders and health experts came together to discuss ways to close the immunization gap so no child misses out on the life-saving benefits of vaccines. We asked these leaders, what must be done to close the immunization gap and make sure every child has access to vaccines?
There's the need for innovations, there's the need for ways to reach all children with vaccines, ensuring that vaccines get to countries and that there's access to them, and then that countries have a sustainable program to continue to deliver them.
What we need to do first is to pay attention that we still have groups of people not being adequately immunized, so we have disparities within countries, across countries.
What it takes to reach the last 20% is actually quite different than what it takes to reach the first 80%. You know, we did that pretty, not easily, it was a lot of hard work, but with some fairly standard operating procedures. Whereas now, the last 20%, you know, a lot of those kids are in conflict zones, post-conflict areas, you know, reservoirs of vaccine-preventable disease. They live in very poor, very large, tough terrain, you know, weak supply chain. So we've got to change from a mindset of standard operating procedure to one of problem solving. And that actually requires innovation.
In Thailand, the WHA program has been evolved for decades. Now we know more morbidity and mortality for vaccine preventable disease in our country. But however, some challenges remain, such as to tackle out-of-pocket population who is vulnerable to access to immunization.
Whenever a sick child or even a well child is brought to a health facility, whether it's for diarrhea, for pneumonia, for fever, for whatever, the health worker should have that cognizance that this opportunity should not be missed for vaccination.
The last mile of this supply chain is the most precarious because a lot of times it involves a nurse from a local clinic going to the storehouse where the vaccines are stored, picking up those vaccines and getting them back to the community health center in time to immunize the children. And those nurses, they could be on foot, they could be relying on a bus, the bus could break down, it's bad roads, there's been a flood, there's a conflict.
I think that we need to move past national statistics and even past districts and look at communities and interact with communities about what are those barriers. Are they gender barriers? Are they financial barriers? Are they supply barriers? But we need to dialogue with communities and understand what are the true barriers for them to get immunization.
What are some of the key challenges that countries face as they aim to strengthen their vaccine systems?
The countries have a lot of programs to deliver on. When one talks about health systems, it's a complex set of procedures, processes to offer services and to increase the demand of those services. And the two have to come together so that, you know, we can reach the best outcome.
One needs to ensure that each and every vaccine is transported safely to the health facility where it will be administered to the requisite children. Now, this is called the last mile of vaccination in logistic terms, and this is, to our mind, is much more important in developing countries.
There really needs to be a strong system that there is not stockouts. We have a lot of stockouts that occur, so being able to forecast your vaccines and the supplies needed to deliver it, as well as being able to make sure that you reach every child with that vaccine.
These people are consumers, they're not beneficiaries, they're consumers. How do we respond to what they're saying they want and they need, like any other consumer, any other part of the world?
You have to work on the demand, facilitating the understanding of the services being offered, facilitating the understanding of the benefits of vaccines. May not be obvious to everyone.
It may sound a little bit boring, but data are really critical. Collecting data on knowing who are the children in your community that you need to reach, making sure that you're accessing these data, that you're utilizing them, and making sure that your decisions are based on these data.
The countries keep up your good work and challenge us, challenge the development partners, WHO, UNICEF, CDC, the Gates Foundation, because these are global public goods and we're going to need a global effort to provide them.
How would you advise policymakers on how to improve access to immunization?
Routine immunization is vital. This is the key point, I think. If the policy decision maker understand this, they will support, and we can move forward and use new technology to support in all everything, such as in supply chain, new research, new vaccine, and new technology to access to the population.
You need to think about what's happening at the district level and below. It's not a one-size-fits-all model. It's different in different countries. It's different in different regions of different countries. So it's taking a look at the data at a really disaggregated level and then using that for decision making.
I would say to the policymaker, make sure that you have a health workforce, not just nurses, not just community health workers, but the managers, the people who are looking after the supply chain, the people who are looking after procurement and logistics, and people who are planning and monitoring programs. If you don't have people well supported in all of those areas, then you don't have a human element that can sustain even the best of systems.
In their capacity as policymakers, I think the most important is looking at what's out there in terms of the data, in terms of the assessments and recommendations, getting involved. Are there regulations or policies or rules that could be put in place? So asking those questions, getting involved, and then secondly, the accountability. Not just asking for something, but making sure that then you ask for reporting back, feedback, so that you get the accountability of the system and follow up.